Alabama is one of the most dangerous places in the country to give birth. Shelby County, with over 230,000 residents, is now the largest county in the state without a labor and delivery department. The proximity to a hospital offering birthing services has far-reaching consequences beyond just a woman in labor. It impacts her entire pregnancy, her well-being, and her child's. 55 out of 67 Alabama counties are considered rural. And if you were expecting a baby in 1980, you could access maternal care in about 45 of those rural counties. Fast forward to 2019, this number drops to a measly 17. This means about 2/3 of Alabama's rural counties are maternity care deserts. Women in these areas travel an average of 31 miles to access maternity care. Statewide, 28% of women live more than half an hour away from a hospital where they can give birth, compared to the nationwide average, about 10%. All of these factors are why Alabama is such a dangerous place to give birth. But maternity care deserts aren't a problem unique to Alabama. Currently, 36% of counties in the United States are considered maternity care deserts. Across the nation, hospitals have been shutting down labor and delivery units for decades due to challenges in retaining staff and supporting services in areas with fewer expectant mothers, especially in rural hospitals aiming to cut costs. Around half of Alabama births are Medicaid funded, reimbursing hospitals at lower rates compared to private insurance, adding to the financial strain on these facilities. In maternity care deserts, mothers are potentially 3 times more likely to die in a pregnancy-related fatality. From 2018 to 2021, Alabama had some of the highest rates in the country of mothers dying from pregnancy-related issues. And for the deaths that occurred in 2016 and 2017, over half were found to have been preventable. The state's infant mortality rate isn't much better. In 2021, Alabama was 3rd in the country for the highest infant mortality rate. So what can be done? Some experts are calling for more financial support from the state and the feds to preserve the services that do exist. In areas with limited healthcare choices, the presence of birth centers, midwives, and doulas plays a vital role in reducing the risks associated with pregnancy. Thankfully, these healthcare providers are establishing birth centers throughout the state. An increase in telehealth coverage would also help bridge the gap, especially if Alabama's Medicaid policy is expanded to provide reimbursement for these services.